Less than a month before school starts, and to keep kids healthy, that means it's time for immunizations. In this month's Prescription Arkansas, THV's Don Scott has details on what vaccinations are needed for your family before the bell rings on the first day of school.
Well, the reason that we vaccinate kids is because we're trying to prevent death.
Dr. Jerry Byrum is a pediatrician at All for Kids Clinic in Little Rock.
You almost have to have a history lesson to understand why we vaccinate kids.
A history lesson that shows child deaths are declining due to immunizations.
In 1900, there were 180 kids for every 1,000 that were born that died in their first year of life. By 1950, with the few immunizations that were there and improvements in water and other things, that number was down to 37 per 1,000. And today, thankfully, that number is only 6.
For those young ones preparing to head to the classroom.
So if you have a child that's between 4 and 5 years of age, it's time for their DTP, their polio, their MMR, and their chickenpox vaccines.
The same amount of immunizations applies to older children as well.
If your child's at the 11 to 12-year-old time period, it's time for them to get a booster of their tetanus shot. So that's very important. They need to get a meningitis shot called Menactra. And then there's a shot against the human papillomavirus called Gardasil.
These vaccinations, Byrum says, are essential for all ages, especially from birth through college.
All of us have to keep up to date with our shots. The infectious diseases that used to kill our kids, they're gone. And so that's just a wonderful thing to see.
For this month's Prescription Arkansas, I'm Don Scott for today's THV.
And Dr. Byrum also described something known as herd immunity, because what one person does affects the health of everyone. He says diseases have not been eradicated, but the majority of the population are immune to it because of the vaccines. And without those vaccinations, the diseases come back.